we're trying to address, because as respiratory illnesses are increasing at an alarming pace in China, there are complaints of congested hospitals and overburdened healthcare systems. Health experts are especially worried about the spread of the human metapneumovirus, HMPV, a respiratory virus in other parts of the region, afflicting a number of Asian countries. Shamim Zakaria joins us, a senior journalist from Beijing. Shamim, thanks for joining in. What are the details that you are getting about the warning from the Chinese Center for Disease Control and Prevention?
Well, the latest update from the Chinese Center for Disease Control, or the CDC, they have confirmed that yes, there is a surge in the cases of this human metapneumovirus, or HMPV, as it's called in short. But the CDC has reassured that everyone do not need to be worried, because it's just like a common occurrence during any flu season. So there hasn't been any rise in the hospitalization rates. Of course, initially there were some rumors about a new strain like causing symptoms, for instance, like fatigue and dizziness among flu patients, but the CDC has clarified that this is not true. The strain circulating is actually the one of H1N1, which is like a common flu strain, and often it is linked to the HMPV virus. And as usual, the CDC has suggested, basic precautions like wearing masks in public, or disinfecting frequently touched objects, and maybe maintaining like a good personal hygiene. And interestingly, if you look at the data that CDC released, it was actually not specifically about this virus. It was part of like a larger weekly updates or monthly updates that they released, I think, just yesterday. And in this report, in this press release, that's where only maybe one paragraph where they mention about this particular virus. And if you look at the data for the hospitalization rates, or even people visiting the emergency, so for instance, for people going to the hospital, the emergencies or the outpatient departments, HMPV is actually the third most common virus in both northern and southern parts of China. So it means that other viruses like the influenza, flu, or even rhinovirus, they are actually causing more problem than the HMPV. And similarly, if you look at the incidence of severe illness happening, so it is also HMPV is also in the third category. So which shows that flu or pneumonia is like a bigger reason for why people are getting sick as compared to this particular virus. And then if you look at what's happening around, like what interesting is that I only came to know about the situation when the different global news outlets, started reporting about it. But if I look at my daily life around in China, it's whether in my office or residential community, I think life is playing completely normal. People are going to work, kids are playing outside, and everything is running smoothly. But yeah, of course, I do understand why people are worried about it. Why there is a sense of concern is because probably it's been just over 2 years where people have the world has come out of the grip of COVID-19. So whenever anything of this sort happens, then people are always concerned that are we going back into the COVID-like situation. But having said that, I think in a nutshell, during flu season, this sort of outbreaks are quite normal, and in life in China is continuing as normal. And what I believe is HMPV isn't something to be worried about, or it is not disrupting our normal lives here.
Well, one only hopes, thanks for that, of course, Shamim. One only hopes that this doesn't turn out to be even a patch of the scare that COVID was. Now, Gurmeet, a lot of chatter about this on WhatsApp groups, right? Does this worry you at all? Could this rattle the markets, or is it a wait and watch scenario?
It doesn't look like right now rattling the markets, but obviously you have to keep a watch. I'm always amazed at why everything comes out of China. I think if you see the context of the Biosecure Act, which probably is not seeing the light now, hopefully later, has been that the future of the warfare is biological, right? And you have to be very careful on these things. And then I've been making this point from a market context and not being very insensitive about is that I think the healthcare opportunity is big, especially the CDMO space, because the globe is not geared up for disruption in supply chains, because pharma supply chains are complex. Some of it involves complex chemistry. There are late life cycle strategies, needs years of testing. So it's not like any other product where you can simply shift. It's not like basic commodities or other stuff. So I think this is one opportunity, and I've been making this point. This is as big as the 1999 IT outsourcing opportunity. Chinese share is in double digit. Our share is probably less than 2%. Some of their big names like the Lonza and Catalans of the world are upwards of $5 billion, in terms of the revenues they do, and we are probably one fourth, one fifth of all the larger names we have. So I think that's an opportunity, and so we obviously Divi's has been an old favorite. We really got lucky with Newland, and now Loris has hopefully started doing well. And we're looking at some more opportunities, in this space. One is Thikal, one is Bliss Pharma. Bliss Pharma is actually a different opportunity. It makes suppositories, so medicines which can't be given orally are actually then given physically or inserted. So they are into that segment, which again is a very unique segment to look at. So you have to go level 2, level 3 here. It's a complex space, but there are opportunities in this space.
Okay, Ruchit, want to switch focus now.